Hi, my name is Lauren Masi. I'm a doctor of physical therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how to get faster, better results from your physical therapy. We are strong believers in getting to the root cause of your pain. We want to make sure that we are as effective and efficient as we can be from day one, so we don't waste your time. Bay Area Physical Therapy has the ability to use advanced diagnostic services that most other physical therapy clinics do not. We offer musculoskeletal ultrasound and electrodiagnostics such as nerve conduction studies and EMG. With the musculoskeletal ultrasound, we are able to see what the structures in your tissues look like. We can look at joints, we can look at muscles, tendons, ligaments, we can look even at some of the nerves throughout the body and really make sure that we can get information to your physical therapist to help customize the programs for you. Nerve conduction studies and EMG examine more of what the nerves do and how they might be affected. So some common diagnoses would be radiculopathies, which means nerves that are getting pinched as they come out of your cervical spine or your lumbar spine, which might cause pain down into your arms. Also, some of you report carpal tunnel, numbness, tingling, pain into the hands, and we need to figure out where that's coming from. Is it coming from your neck or is it coming from the wrist? And that can certainly change how we make up a plan of care for you. We want to make sure that we have a correct diagnosis to be able to make the adjustments necessary. And if we find something a little bit more significant than we thought, like a tear, that we can refer you to the proper medical professionals. This means if you need a surgical repair, we can get you a referral to a doctor as soon as possible. And if it is just a sprain or something a little bit less significant, tendinitis or tendinosis, we know how to handle that in-house. We know that in physical therapy, we have certain treatments that are more geared towards those diagnoses. For example, if you have a more chronic hamstring injury, tendinosis, for example, we might want to make sure that we're including instrument-assisted soft tissue techniques, which can use tools to kind of help us work on the tissues, or forms of cupping or myofascial decompression. And there's also a certain type of strengthening that we're going to use to load the tendon appropriately to get you those faster results. We believe this is the most effective and efficient way to treat our patients. Lastly, the most important thing to getting better results faster is the commitment of you, our patient, not only to coming into all of your sessions, being consistent with care, but to doing your home program. You're only with us a couple times a week at most, and obviously there's many more hours in your day and in your week that we want to make sure we're not flaring up things or slowing your progress. So together we can get you back on track and back to normal functioning without unnecessary medications, injections, and surgeries. Please call our front desk today to set up a complimentary consultation or evaluation to help you get the fastest results you can.